All right. Okay, we are recording.
Yeah. Okay. Put it into presentation mode. Grace, does that look correct?
We still have the little gray boxes. So
Okay. Do that. I'm going to try to X out of that. Does that help at all?
yeah, they're going away.
Okay, great. Okay, well, good. Well, welcome everybody. I appreciate y'all being here. I'm excited to talk to you today. And my name is Elizabeth Diehl. Most people call me Lee, although it looks like it's spelled like Lee. I pronounce Lee. And I am the Director of Therapeutic Horticulture at the University of Florida. I'm also a lecturer in the Environmental Horticulture Department, and I have a 50-50 teaching and research appointment. So my teaching is in horticultural therapy, and then my research is in really more in therapeutic horticulture. So, and I'm very proud to say that we have a big night tonight. I know you can't see my t-shirt, but I'm proudly wearing a University of Florida t-shirt because our basketball team's going to the national championship tonight. So very excited. Actually, my husband and my son are at the Final Four or at the game, so they're excited. So anyway, a little plug for UF basketball. I want to tell you a little bit about what we're going to be doing today. For some reason, my screen is not advancing. There we go. Okay. So what I want to talk to you today is primarily about the differences between horticultural therapy and therapeutic horticulture. And I'm going to do that by starting off with some definitions of practice. And then I'm going to show you some examples of horticultural therapy work. And then I'm going to introduce you to our therapeutic horticulture program at Wilmot Gardens at University of Florida. Just real briefly give you some history, because as master gardeners, I think you might be interested in the history of the gardens, and then provide some examples of therapeutic horticulture work as well. And then wrap it up by telling you briefly about a couple of research projects we have going on in therapeutic horticulture, and just sharing some information about our certificate in case anybody's interested. So talking about definitions of practice, when you're referring to horticultural therapy, this is the participation in horticultural activities facilitated by a registered horticultural therapist and meant to achieve specific goals within an established treatment, rehabilitation, or vocational plan. So horticultural therapy is an active process which occurs in the context of an established treatment plan, where the process itself is considered the therapeutic activity rather than just that end product. Now, therapeutic horticulture is also the participation in horticultural activities facilitated by a registered horticultural therapist or another professional with training in the use of horticulture as a therapeutic modality to support goals. Therapeutic horticulture is the process through which participants enhance their well-being through active or passive involvement in plant and plant-related activities. And both of these definitions are those of the American Horticultural Therapy Association. So really what this boils down to is that these two program types are differentiated on the basis of individualized goals, an individual treatment plan with individual goals for a single person, or group goals. In other words, you're working with a whole group of people that all have, say, Parkinson's disease. And so your goals are for the whole group rather than for individuals within the group. So that's really the easiest way to describe the difference. Haller and Capra, who have written a couple of textbooks in the horticultural therapy arena, refer to horticultural therapy as a professionally conducted, client-centered treatment modality that uses horticulture activities to meet specific therapeutic or rehabilitative goals. And the purpose is to maximize clients' social, cognitive, physical, and psychological functioning, as well as to enhance their health and wellness. This definition that I just said really came from Diane Relf, who actually was at Virginia Tech and one of the pioneers of horticultural therapy. And she writes about that there are three essential elements in horticultural therapy practice: defined client groups, in other words, a client group that has a specific diagnosis. Also, that it's goal-driven, and those goals are based on the needs of that particular client group and their disability, disease, or special circumstance. and that the cultivation of plants is the primary type of activity. So that all three of those things need to be present in order for this to be horticultural therapy as well as therapeutic horticulture practice. So what I want to do now is give you some examples of what horticultural therapy programming actually looks like. And I'm going to do this by introducing you to a program that I started in Chicago in, gosh, the early 90s, where I was working at a residential facility for young adults with developmental and physical disabilities. And I'm going to be very transparent and tell you that I had never heard the term horticultural therapy when I actually started this program. I learned about it as I was going and discovered that that was what I was doing, but hadn't realized that that existed as a profession. So in this particular place, this is a picture of part of the campus, the upper left here. It's called Misericordia Home. And as I said, it's a residential setting for young adults with developmental and physical disabilities. It's a really beautiful place. It's on the north edge of Chicago. And there's all different types of housing styles there because they serve people with severe and profound disabilities as well as those with mild disabilities. So I was really lucky to be able to start up this horticultural therapy program. I had finished graduate school. I was interested in moving back to Chicago, which is where I'm from. And my little brother, who actually happens to be the young man in the wheelchair there on the right, had been living at Misericordia since I moved to college. And so I wanted to come back and kind of started to figure out this connection between people and plants and nature. And I wanted to start a community gardening program for the residents here. So when I reached out to the director, she said, will you just come work for us? Because we can see how something like that could be really beneficial for some of our residents. So I thought, I had finished my graduate program in landscape architecture, and I thought I was going to go into a landscape architecture firm someplace, but this sounded like a really cool opportunity. So I took it, and it's sort of my career path kind of grew from there. So I'm going to show you some examples of different horticultural therapy goals. And remember, I told you that in horticultural therapy, we are creating individualized treatment plans for people in the program. So in this first case, we were working with Mark, who is here in the lower right. He has cerebral palsy. And one of the things that his treatment team was wanting to do was to try to increase his dexterity and the strength in his hands. You can see his right hand there, he doesn't have a whole lot of use of, but his left hand is, which is not uncommon, he can actually do some things with. So we came up with this idea to create a goal where we would basically we were trying to do the long-term goal was to increase his fine motor skills. So we hoped over time, and this could be 6 months, this could be a year, this could be 2 years, that we could help him to increase his fine motor skills. But we knew it was going to take a lot to get there. So we had to come up, as we do with all of these situations, come up with a series of short-term goals to help us support that long-term goal of increasing fine motor skills. So we, at that time, had only a classroom setting. Our plants were all in a classroom. You can kind of see in that lower picture there, we had grow lights. It was very dry in there. And so the plants really needed to be misted in order to stay healthy. And so we decided to give Mark that job. And so you can see we had 4 short-term goals here. The first one was just that he would tolerate the hand-over-hand spraying. He wasn't able to get his hands gripped around a spraying bottle. So at the beginning, I would go hand over hand with him to help him push that trigger, and that he would tolerate that for 3 minutes. And then once he achieved that goal, we could move on to have him grip the spray bottle. Just hold on to it, not even necessarily press that trigger. Once he was able to do that, we could then move on to the next short-term goal, which was for him to actually squeeze that trigger to spray the water at least 3 times in 5 minutes. And you can imagine that with all of these specifics, certain number of minutes, a certain number of times, we can track over time whether he's progressing in this goal or maybe we need to rework it in some way. And then finally, what we were working toward was that he could spray these plants independently. So that's just an example of how we're taking some short-term goals and we're trying to get to that longer long-term goal. And so it was pretty amazing to see how this worked. It took a while for him to be able to gain the function and the strength and the grip to be able to do this, but this was so exciting for Mark. And I just realized Mark is his real name. I had put Juan in here to use as a different name, but that's okay. I'm not telling you his last name. Anyway, it was just so exciting because not only was Mark able to do a job that was really important to keep the plants healthy, but he was over time able to do that independently. And we could talk about how important that job was. So he went from feeling like he wasn't really contributing much to be able to realize that he was contributing pretty importantly to a job that really needed to be done. And so that was helping him to build self-confidence, self-esteem, and things like that. And what also was really exciting is by learning this skill, this new skill and new ability transferred over to other things, like having better control over the joystick on his electric wheelchair and being able to grasp his spoon or fork or pencil better as well. So this activity, although it was horticulture based, actually had a much wider reaching effect for Mark. So that was really great. Here's another example. In this case, this is Virginia. She's on the left. And Virginia came to live at Misericordia in her 50s. She lived her entire life at home with her mom. And she was really having a hard time adjusting to her new life at Misericordia. She really missed her mom. She had not really ever been around lots and lots of people, certainly not in a living environment like that. And so it was really kind of getting in her way. She was very shy, getting in her way of making friendships. So the treatment team came together and decided that one of our long-term goals would be to develop friendships at the facility at Misericordia. And so we knew she liked gardening. She'd done that with her mom. So the treatment team said, hey, let's try her in the horticultural therapy program and see if we can work on some of these things there. And that made sense because it was an environment she was somewhat familiar with. She liked plants. She was comfortable around plants. So we developed a series of short-term goals for her. The first one just being to verbally respond when you're greeted at the greenhouse. So maybe it's just saying hi back, something like that. And then once that became much more habitual and regular, then we could move on to another where we worked on encouraging her to answer a question when somebody asks her, avoiding that yes, no response so that it would hopefully lead to a little bit more conversation. And then eventually for her to actually initiate a conversation herself with a workmate. And so, although this isn't really a horticulture-based skill that we're teaching her, we're using the horticulture environment as a way for her to be more comfortable and as a source, like a resource for those conversations. So she's naturally more comfortable when she enters the greenhouse. So that helps her be a little bit more open to working on these goals. At the beginning, we would ask her a question that was plant or horticulture or work related, so that was also something she didn't have to think too hard about. And then when she was first initiating conversations on her own, we'd encourage her to use the greenhouse or plants as a basis of that conversation. So this really helped her a lot. And she was over time able to get more comfortable and to really establish some good, important friendships. Now, my third example is about Martha here. And Martha had the opposite problem of Virginia. She talked all the time and never stopped talking. And she always talked about her mother, which was not all that interesting for some of the other residents. And this was also getting in her way of making friendships because, she kind of got the reputation of, oh boy, I don't want to sit next to Mary Jean today because I'm never going to get a word in edgewise. So although she was being outgoing and friendly, she was dominating. So she was also struggling. And similar to Virginia, she had come to Misericordia also late in her 50s. Her mother had passed away. And so she was also not used to this kind of a setting. So for her long-term goal, same as Virginia's, Martha will develop friendships at the residential facility. And then her short-term goals are a little bit different than Virginia's. First of all, we worked with her to decrease her conversation about her mother. We weren't saying she could never talk about her mother, but that shouldn't be everything that she talked about. And so, this doesn't just happen by us telling her that. We have to work on it over time. So she might come to work one day and start talking about her mother, and I might say to her, hey, Martha, it's, so glad that you're thinking about your mother, but do you think we could think about another topic of conversation? Or I'd have to verbally prompt her to switch gears and think about something else. So once we could kind of get that a little bit under control and get her comfortable talking about other things, then we could actually move to the next step, which was to ask somebody else a question about their work. So she's not always talking about herself. And then eventually for her to learn how to converse with her workmates and her friends without dominating the conversation. And so this took time. It did not happen overnight, but it's the result of some carefully constructed short-term goals to support that long-term goal. And it did make a difference. People stopped avoiding sitting next to her after a while and found that she actually had a pretty good sense of humor once we could kind of break through all those layers to have her be more comfortable and be able to recognize that she actually enjoyed hearing about what other people were doing as well. And again, this isn't necessarily a horticulture-based skill, but the horticulture setting really helped us to crack her open in that way, because again, she really also enjoyed gardening and did a lot with her mom. I wanted to show you this example of a sheet that we would use. So, I mentioned that we had these goals. And so with each short-term goal, we would have something like this at Misericordia. And in this case, we're talking about Betsy, and her short-term goal is to not interrupt or to talk over another person during a conversation in the greenhouse. So very clear what we're working on there. You can see there's a place for us to chart. There are codes so that we know what the different chartings mean. And then at the bottom is a procedure. So in this case, we came up with a procedure that if Betsy interrupts or talks over another person, then a staff will immediately prompt her to allow the other person to finish talking before speaking. And there's even an example of how to do that. Betsy, please allow Martha to finish speaking before you speak. And then there's some place for notes. So this is kind of how we would track our progress on that particular goal. And over the course of the month, this is what that might look like. So usually this is month to month. That doesn't mean that we expect them to achieve. And actually, now that I'm looking at it, it looks like it is actually over 2 months, because we're starting in March and we're ending in May. But the time just corresponds to what we think is the amount of time the individual is going to need in order to achieve this goal. So you can see in this case, this participant was working on this once a week. So maybe they came to the greenhouse once a week, or maybe there was only the opportunity for us to work on this once a week. But you can see in this first thing, they needed 3 verbal prompts on this particular day. And that was me, Lee Diehl, that did that. The next time they only needed 2 verbal prompts. On the 19th of March, they actually had a behavior issue related to that task, and there would probably be notes about that someplace else. Here on May 10th, they actually did this independently. So that was exciting. So the hope is that you're seeing fewer verbal prompts and more independence in these different goal sheets. So just some quick examples of what horticultural therapy short-term goals might look like. Within 5 minutes of entering the greenhouse, Quinlan will independently look for and ask permission to complete a task that he thinks needs to be done. So perhaps we're working on initiative in a more vocational manner with Quinlan. We just talked about Betsy not interrupting. Here, Ricky will initiate conversation in the greenhouse once per session. That's kind of similar to Martha and Virginia. Another one, Tony will start making a list of 3 things that need to be done in the greenhouse within 3 minutes of entering. And then once written down, he'll show that list to staff. So maybe we're working on some job skills with Tony. And then this last one, Eric will not talk about his departure from the greenhouse, needing to get ready to leave, or concern about the time more than 5 minutes before session. And this was a specific one. Eric had autism. And so he would get very concerned about needing to catch the bus. He didn't want to miss the bus. That had really been drilled into him that he couldn't miss the bus. But what happened is he would get so anxious about it that within 15 minutes of arriving to the greenhouse, he would start thinking about it, and it would get in the way of his doing other work. That's not going to work in a job situation. So we needed to really be able to work with him on improving that, decreasing the anxiety, and also improving the understanding that he's got to be thinking about his work when he's actually at work. And then the last example I want to show you is for Walter, and actually this is my little brother that I introduced you before. Walter had a traumatic brain injury when he was about 2 years old. And as a result, he was in a coma for a while. And when he came out, he had to kind of learn everything all over again, how to talk, who we were. And he was never able to walk on his own. So he's used a wheelchair ever since then. Really, really happy guy. He's just a few years younger than I am. So this picture is from a pretty long time ago. But one of the physical therapy things that Walter needs to do, as do all of the residents that use wheelchairs, is a stander, so that it gives them an opportunity to stretch their muscles and to make sure that they're not atrophying and things along those lines. And Walter really did not like this. It was uncomfortable. You can imagine if you're in a sitting position all the time and then you're stretched out into the standing position, it can be really uncomfortable on your muscles and things like that. So he was being very intolerant of this and complaining a lot and not staying in the stander as long as we had hoped. And so his treatment team decided, maybe, what if we bring the stander into the greenhouse? He's already coming to the greenhouse every day to work. So maybe we could try combining those things. So we brought the stander in. We have fitted a tray. You can see in the picture on the right and the left there. And so that he could do work. He didn't have to just stand there and watch everybody else. And then as sort of a cherry on the top, we allowed him to choose the job that he wanted to do during the time he was in the stander. And that helped a lot as well. Well, we found pretty quickly that Walter was able to tolerate longer and longer standing sessions in the greenhouse. And I think there's a lot of reasons for this. I think one is that he was more relaxed in this setting that is full of plants and air, fresh air and all that kind of stuff. He was able to do something rather than maybe just watch a movie or look at a book. He actually was doing something that felt a little bit more productive. I think that he probably felt, and Walter's not somebody that could verbalize these reasons, but my guess, knowing Walter, is that he may have felt more of a sense of control because we were allowing him to choose what he wanted to do while he was in the stander rather than just being told he just has to be in the stander. And so I think all of those things contributed by just kind of shifting the requirements or the environment, that could make a big difference. And I actually think, again, I don't know this for sure, but I actually think that Walter probably really enjoyed being in the greenhouse in the stander because he had a completely different viewpoint perspective. Typically he's sitting in a wheelchair, his viewpoint is down low. Here, he's probably a good 2 or 3 feet higher. And so he can see across the greenhouse, he can kind of see what everybody else is doing, and it's a very different vantage point. And I think he enjoyed that. So that was another really exciting, achievement that we had, and another way that we could find that we could use horticulture-based activities to increase physical function. And then my last example of horticultural therapy here is with this young man who has Down syndrome, and he was struggling with behavior issues across campus. He would get frustrated about something and burst into kind of a angry thing about how he didn't want to do this and blah, 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 and just get frustrated, and it would shut him down for the rest of the day. He'd end up having to go back to his residence and kind of sit there and, do whatever he did there, but he was missing out on work. He was missing out on being with his friends. He was missing out on his paycheck. And so it was really getting in his way of his life. So the treatment team decided to try Mark in the greenhouse, that maybe there it would be a little bit more relaxed. It's a little bit different than some of the other places on campus. And so we decided to give that a try. Well, we found with Mark pretty quickly that he did not like being told what to do. If somebody said, "Mark, please do this." Oh, it looks like Yolan, you are scribbling on the screen there. I don't know. I'm sure you don't mean to be. Maybe you think your mouse is on or something. So what we were kind of in a conundrum here because Mark was very capable. He was getting paid for the work in the greenhouse, but we needed him to do the work in order for it to get done and for him to get paid. But if we couldn't tell him what to do, how are we going to handle this situation? Because we didn't want to set him off on these behavior episodes, but we also needed him to work. So the greenhouse team kind of brainstormed about what to do, and we came up with this concept of creating a mailbox for Mark, where every day, before he came to the greenhouse, we would put a job list into that mailbox. The mailbox was exciting because the residents at Misericordia don't have individual mailboxes. And so this was exciting that Mark had a mailbox. So every day, one of his goals was within 5 minutes of arriving at the greenhouse, he needed to go into the mailbox and take out his job list. And I think I have a picture of what a job list would look like. Yeah. So in this particular example, his 2 jobs were to help Matt cut back the hibiscus that's outside, to sweep Lee's office in the front hallway. And then usually once he achieved those, we would use, and oftentimes we wrote it on the job list, is that he could choose his third job. Now, what's really interesting about this is that Mark couldn't read, so he couldn't see what was on this job list. But he was allowed to take this job list to any staff or volunteer and have them read the list to him. Somehow he didn't feel like that was being told what to do. And maybe it was because he knew it was there. He was in control of getting it out of the mailbox and taking it to somebody. And so maybe he sort of felt like that person was helping him rather than telling him what to do. But we found pretty soon after instituting this that Mark's behavior episodes reduced pretty significantly. Not right away and not completely, but a large amount, a large percentage of them went away. And that meant that he would stay at work longer, he got paid more, he got much more positive feedback, he was able to interact with his peers more often. And it was really a positive thing for Mark and Mark's life at Misericordia. We actually found within a few months of us working on this at the greenhouse, we were starting to get reports from his other jobs on campus that they were also seeing better behavior results from Mark as well. So that was really exciting and life-changing in a lot of ways. You know, and the other funny thing here is that Mark didn't really like plants. He didn't really want to be interacting with plants. He didn't want to be potting or transplanting or anything like that. He wanted to be the maintenance man at the greenhouse. So he loved taking out the garbage. He loved sweeping and cleaning up. And so again, recognizing his strengths is an important component of horticultural therapy. And we knew that he would be more motivated if he was doing stuff he wanted to do, but also things that needed to be done in the greenhouse. Things have to be clean in order to have a healthy greenhouse. So that was really a win-win situation. This is Mark relaxing after he'd done his first two jobs. That we asked him what, you know, he could pick a job now, and he said he wanted to go outside and make sure everything looked okay. And I came out and found him lying there. And I include this picture because it's so important in horticultural therapy and therapeutic horticulture programs that we make sure that we are giving the participants the time to enjoy the work that they've done. A lot of times it's hard work. And so not just rushing through it and then moving on to the next thing, but saying, hey, let's look around ourselves and let's, you know, recognize and acknowledge all the work that we've done. And so really taking that time to appreciate the work, appreciate nature, smell the flowers, all those kinds of things are really important component of these types of programs. So next, I'm going to tell you a little bit about some examples of therapeutic horticulture. But before I do that, I want to really quickly introduce you to Wilmot Botanical Gardens at the University of Florida, where I work, and tell you a little bit about its history because it really is interesting. This is the historic marker that the university gave us after we restored the gardens. And I say we, even though I was not part of that restoration process, I came a little bit later. But this gentleman's name is Royal James Wilmot, and he is who the gardens are named after. He was a expert in camellias, and he was known around the world for really knowing how to grow camellias, knowing how to classify camellias. We think this is a picture of him in the gardens with a camellia. On the right is him and his dog Ginger. Apparently this was a well-known dog on campus. And he did a lot of the extension bulletins. So in this case, you can see one's 1950, one's 1944, camellia culture, camellia growing, things like that. So really well known around the world for his expertise in camellias. At that time, this was what that area of the campus looked like. And I'm showing you this picture for a reason. I'll come back to it in a minute. But down in this area, kind of the lower left, is where the gardens would have been. So you can see that it's very agricultural. There's a lot of greenhouses here, wide open spaces. People would come to the gardens for picnics. The community members loved it. There were lots of weddings that took place in the gardens. And so they were really loved in the Gainesville community. Unfortunately, in 1952, Roy died at an early age. This is the picture of his wife unveiling the monument that was created in his name in the garden. And it was a shock. I don't think it was expected. I honestly, I don't know what the cause of death was, but because of this, people in his honor donated camellias from all over the world to the gardens. Japan, England, France, all over the place. And so there was a beautiful collection of camellias in his honor. And at that time is when the gardens changed to Wilmot Gardens. Unfortunately, in the 1970s, the university stopped actively maintaining the gardens. Budgets were tight. And so in Florida, as in many southern states, if you stop actively maintaining any green space, it's going to get a little bit overgrown and a little bit crazy. We had pine bark beetle infestation that killed a lot of the overstory pines, and then back-to-back hurricane seasons knocked down a lot of those pines. Lots of invasives, air potato, all sorts of stuff came in. And so it was, you couldn't really even walk through here. There's another picture. Well, what happened is Dr. Tischer, picture of him here, who was the dean of the College of Medicine, worked at UF for a long time. He drove by this space every day for about 25 years and recognized the potential of it, but also recognized that if something didn't change, it was probably going to be turned into a parking lot or another building. So in his retirement in 2006, he took on or requested the permission to take on the restoration of these gardens. And so he put together a small group of volunteers, most of which were master gardeners, and they worked tirelessly on the weekends for several years to pull out the invasives, to pull out the dead trees. I think they pulled out something like 60 dead trees and just tons and tons of invasives. And it was a big project. And of course, the restoration continues to go on, but the gardens are now beautiful. They found the monument that was under there. It's been cleaned up since. And one of the things that we've tried to do is to honor some of the original design aspects of the garden as much as possible. It's smaller now because the university has taken over some of it. It's about 5 acres. But one of the things that was so exciting is under all that mess, the volunteers actually found some of the camellias that were still growing. They were still alive. So those are restored. I know I wish this wasn't such a blurry tag, but I believe that this tag says 1948. So they found this alive camellia that had been planted in 1948 that was still going. Since then, many, many more camellias have been planted, and the gardens really are beautiful. There's some very cultivated areas. There's some very natural areas. Just wanted to give you a quick view of that. So I'm showing you this because this is where our therapeutic horticulture program is housed. And we are right in the southwest corner. And so we have the entire gardens to really take care of as well. You can see the greenhouse in the background.
So how old is this child?
I think somebody's microphone might be on. Just hearing a little bit of background. We've got a beautiful Japanese maple tree garden as well that was donated to us. So some really beautiful destination points. And I showed you this. Again, this is Dr. Tischer in the lower left and the current, well, not current, but at that time the picture was taken, the dean of the College of Medicine. Just honor, you know, being honored by that sign, the historic marker. So remember I showed you this picture and I said Wilmot Gardens is down in this area. Well, this is what the area looks like now. Very different. So here's the UF Health Shands Hospital. The Veterans Hospital is over here. There is a Davis Cancer Pavilion, Shands Medical Plaza. There's research buildings over here, the Cancer and Genetics Building. And this right here is Wilmot Gardens. So it's literally a green island surrounded by, and actually there's more buildings. There were some buildings that weren't even built yet, but it's literally a green island surrounded by buildings that have a lot of fairly stressful things going on. So it does have a really important component in the campus in terms of providing a place of restoration, providing a place for people to eat lunch, to get out of that doctor's office and take a walk until the next doctor's office. You know, we draw, UF Health draws from not just Florida, but Georgia and even Alabama and some other places as well. Real quickly, I'm going to show you a video so you can see, get a better sense of the program.
I drove by this area every day to and from home, and I was just curious, what is it? Because it was sort of like a jungle. And when I became Dean of the College of Medicine in 2002, I became even more interested because I realized that this was the only remaining green space on the Health Science Center campus. Talking to some people, I thought we should restore it. we decided that the gardens should not just be a place to come sit and enjoy the outer doors, but in fact reflect the activities of the buildings that were all around us. So that was research, education, and patient care.
We were noticing that a lot of people were coming to the gardens to get away from the stressors that are happening around these gardens. And so we thought it was time to make that experience more purposeful, more intentional. That's when we started the Therapeutic Horticulture program. I have a little brother who had a traumatic brain injury when he was little. And so growing up with that experience, I think I always recognized the importance and the value in people with special circumstances. We are giving people the opportunity to build up their self-esteem and their sense of self-confidence and self-worth. So many of the folks that we've been working with, because of their disability or their disease or their whatever issue they're struggling with, they've felt that they haven't been contributing to society, and that makes them feel bad about themselves. So I feel like it's my job to help them understand the value of what they're doing here in the greenhouse and that their work really has meaning. And we also try to provide a community here so people can really feel like they're part of this space, part of this place, Wilmot Gardens, this greenhouse. And I think building or rebuilding a sense of community for some of our participants is also very important.
I think that a lot of times when people are struggling with mental illness or they're struggling with a physical disability or any other life trauma or event, that connecting with a stranger that may not be the same age as them or may not have the same experience as them or may not have anything in common with them is a sort of experience that is really valuable. And the horticulture therapy program in particular is so unique because it connects students from the university with people in the community to build connections over something of a third party like plants. And so it's really a unique opportunity to be able to have that experience. Hopefully one day I can become a healthcare professional that incorporates nature and plants into the healthcare setting and practice.
Okay, so I just wanted to show you that so you had a sort of a sense of the layout of what we have right now. And this this slide shows you many of the groups that we've worked with over the years. I actually initiated the Therapeutic Horticulture program at UF in 2012. That time we did not have any space of our own, and so we were borrowing some space in one of the other greenhouses. And then we got a donation to build the greenhouse, a donation of $500,000, which was unbelievable. And we were able to build this greenhouse, which opened in 2014. Once that was open, we were able to provide services to a lot of other people. And I've got these two boxed out because I just wanted to point out in therapeutic horticulture, although we aren't creating individualized treatment goals like the examples I gave you with horticultural therapy, we are still creating goals. And so we're going to create goals based on a group's needs, special needs, things like that. So as an example, those activities that I'm going to design for somebody with movement disorders like Parkinson's is going to be very different than the types of goals and emphases that I'm going to have for inpatients at our psychiatric hospital. So it's going to look different. We could be using the same activity, but the things that we emphasize, the things that we stress are going to be different between those groups. So a couple of examples here. This was a group of adults with Parkinson's disease. And so based on the research and our understanding and knowledge of people with Parkinson's, some of our group goals that we decided on for the entire time they were working with us was to maintain fine motor skills, practice cognitive skills, encourage their mobility, and to maintain, and even if we could increase their social interaction, all the better. So all the activities that we did were based around doing those kinds of things. In this case, they're on the left, they're working on a plant pressing activity. So they've been out in the garden, they've been collecting plants, they're putting them into a press. And you can imagine all of the things that go with that. Cutting them, laying them out, talking about what we're going to do with them, that can all get toward these group goals. Another example were with some veterans with mental health struggles that we worked with. Many of these gentlemen had bipolar disorder and they were sedentary. Many of them were overweight. They weren't really socially connected to each other. So our group goals for this group was to improve their social interaction, increase their exercise, and expand their leisure activities. So if we could get them interested in horticulture and related things, maybe they'd spend less time on the couch watching television and more time outside in a garden or working with plants. So we did a lot of activities that would engage those skills, and actually really had some great success with this group. So much more social interaction and smiling and understanding. And it was really, that was a great experience. We worked with them for a long time until COVID hit. Another example, we worked with a group of young adults with autism, and the main focus of this group was to build job readiness skills. Not necessarily meaning a job in the horticulture industry, but just that they were ready to, do some of those soft skills, communication, problem solving, some things like that. So we were using horticulture as the vehicle to work on those different skills. So their group goals were to practice appropriate workplace communication, to build their problem solving skills, to increase their teamwork skills, and also for many of them, increase their sensory regulation. We were able to get them to be able to improve those skills in our horticulture setting, then that would put them in a much better position to hopefully get some independent employment or maybe some sheltered employment. So everybody in the group is working on the same goals. We're not individually tracking them, but they're all, because we know about that population, that we're able to create relevant group goals. This is an example of, and I don't expect you to be able to read all this, but an activity sheet we might use in the therapeutic horticulture program. So in this case, it's a plant pressing activity. And at the top here is the overview of the activity, basically what it's about. Here in this box, these are some materials we need. And at the bottom are the general directions for accomplishing this activity. But it's this section, which I'm going to show you in the next slide, the primary goals and benefits that we want to emphasize in that session. And those things are going to change depending on the group that we're working with and the particular group goals that we're trying to support. So in this plant pressing session, we are trying to, I'm not giving this to the participants, I'm giving this to my trained volunteers, my trained master gardeners, students, that sort of thing. So I'm wanting them to emphasize sensory stimulation, motor skills, and social interaction in this particular plant pressing activity. And so I give some examples. Well, think about the sensory stimulation of seeing and touching, smelling the leaves when you're out in the garden collecting, noticing the sounds and the smells, the views of the garden out there. And also, as I mentioned before, all the motor skills that go along with clipping plants and handling and arranging them, putting them in the press, even just tightening the press to squash the leaves and flowers. And then what social interaction comes along with that? Well, we can talk about what we've chosen. We can share plant materials. Maybe Mrs. Jones says, oh gosh, Mr. Smith, I didn't see that beautiful flower out there. I wish I had collected some of that. Maybe Mr. Smith says, I'm happy to share some with you. And so those are really good things that can be happening. And then thinking about the future. What's going to take some weeks for these to dry? What are we going to do with them once they're ready to go? And so what is really important to understand is that you might look at these and think, well, those are just going to happen as you're doing this activity. And in some cases that's true, but what we're trying to do in a therapeutic horticulture program is to draw attention, draw an emphasis to those things. We can't be sure that social interaction is going to take place, or maybe not at the level we want it to. So we need to be intentional about designing these things into the actual activity, and to design even prompts into the activity to point things out or talk about how this is working or encouraging social interaction. And this kind of stuff is what elevates it from a horticulture activity to a therapeutic horticulture activity. The last thing I want to say, and then I'm just going to wrap this up by telling you about a research project we're doing, is that I rely heavily on master gardeners to assist and support my program. They all go through a special training in therapeutic horticulture. Most of them have great plant knowledge, but may or may not have any knowledge in human science or psychology or anything like that. So they can't run a therapeutic horticulture program on their own just because they have really good plant knowledge and really great intentions. People that are practicing this, therapeutic horticulture practitioners, horticultural therapists, they've gone through a pretty rigorous training and internship work experience in order to be able to put all these things together to run what would be referred to as a therapeutic horticulture program or a horticultural therapy program. I say this because I have a lot of master gardeners and master gardener programs that want to provide some services like this to groups, their constituents and the people in their county. And they wonder if they can use the term therapeutic horticulture. And I usually tell them, no, that's not really accurate, because unless you've had the training, you're not truly providing that therapeutic experience. That is not to say that you're not providing a really valuable, important experience, but perhaps using a terminology like social horticulture or community horticulture or horticulture would be a more accurate way to describe that program. I think that probably the people that are participating are still getting a lot of the benefits that they might also draw from a therapeutic horticulture program, but it's not created and designed and delivered in the same way. So if you want to talk any more about that, I'm glad to, but that's something I think that it's important to recognize, that people that run programs like this have gone through pretty rigorous specialized training. The last thing I want to do in my last couple of minutes here is to mention a couple of research projects. That's, I mentioned that I'm 50% research, 50% teaching. So I do a fair amount of research. One of our ongoing research projects right now is for University of Florida students struggling with stress, anxiety, depression, loneliness. And about 4 years ago, we started a program for them that they come once a week for a semester, and we have a counselor come over from the Counseling and Wellness Center and introduce some kind of a wellness strategy. It's different every week. It could be mindfulness. It could be a dialectical behavioral technique, a meditation. It could be a grounding or a breathing technique. And then we pair that with some kind of a horticulture activity. So these are just some of the recruitment flyers that we have. We have found that those students that participate in 8 sessions in the therapeutic horticulture program have statistically significant decreases in stress, anxiety, and depression, as well as statistically significant increases in belongingness. One of our goals is to really build community so that they have each other for support, and also to build their understanding, first of all, their comfort and their confidence in growing plants. And second, their understanding and how plants and nature can really help them to boost their personal wellness. And we also found an increase in statistically significant increase in their academic resilience, which was really exciting. There are actually 3 subsets to that. One is perseverance, one is ability to manage negative affect, and one is in help-seeking behavior. And all 3 of those things were increased. That preliminary data led the former president of the UF to give us almost $500,000 to expand this program. So we actually have 5 groups going on this semester, and we're really excited about that. My goal is to package that and then to take it to other universities to see if we can replicate those findings. And then the second study I want to tell you about, this was just a pilot study. It was a one-time session, and we partnered with UF's Physical Medicine and Rehabilitation Department, looking at people with chronic low back pain and whether gardening activities could be beneficial for them. We actually found that there was actually 2 parts of the study. One was on interest in horticultural therapy as an intervention, and that 68% were interested in learning. But the one that was really exciting were those that actually participated. We had 9 patients participate, and we found of those, there was a 55% improvement in anxiety. When you have chronic low back pain, which I'm sure there's some people here that do, you're afraid to move because you're afraid to trigger that pain, and then it takes so long to go away. And of course, not moving is not the right thing to do. So we found that 55% improvement in anxiety about movement, a 31.5% improvement in spine flexion, and a 27.5% improvement in spine rotation to the left. So that was really exciting. We'd love to expand this program. The last thing I want to mention is that we do have a certificate in horticultural therapy at University of Florida. It is completely online and it is completely asynchronous, and you do not have to be a traditional student to take it. It is also open to what we refer to as non-degree students. I'd say 60% of my students are practicing professionals. They're my age or older. And then we've got certainly our group of UF students as well. But this is a really exciting thing. If you're interested in this, or you know somebody that might be, I'd love to talk to you more about that if you want to know. But it really is a great program. Here are some my email if you want to reach out to me, some more information about our gardens and also about the certificate in horticultural therapy. I just realized the last thing I want to mention and have a slide for it was that we, about a year ago, launched what's called the Therapeutic Horticulture Activity Database through University of Florida. If you just Google THAD, I'll actually try to put the link in the chat, THAD at UF, it'll pop up. There's over 250 activities in there. And as master gardeners, you might find some really great creative ideas that you can kind of take and play with and figure out whether you just want to do them within your own group or you want to provide them for maybe some senior citizens or something like that. It's a really great free resource. And with that, I think I'm finished.
Awesome. Thank you so much. I'm very inspired by this. A lot of you might not know, but while I was a college student, I was elder care for my grandmother, who was an avid gardener. And so as she was cared for at home, so we had to come up with some creative solutions to keep her active and engaged, but also involved with us. And so that I really do think that being engaged and her love of plants did really help her quality of life. So I'm very interested in this. I also see a lot of really, really good questions in the chat, which we will certainly not have time to get to all of them, but I wanted to address the certificate program question right now. We don't have time to have a conversation about it during this platform, but late summer, I'd really like to start a discussion in Virginia about certificate programs, communities of practice for this kind of work with our Extension Master Gardeners to make sure that everybody feels very equipped to do this kind of work, and that we can all learn from each other, because I think sometimes we do find ourselves on little silos. So with that being said, you should be expecting more information from our office in a couple of months about more opportunities related to this topic. But there are some excellent questions for Lee about this work, and I wanted to start with goal setting. And so how do you determine goal setting for individuals? Mostly the questions that we have is like, do you involve the individual in the goal setting, or is there some kind of information that you get from their healthcare provider that helps with that? How do you go about goal setting for your clients?
That's a great and a very important question. And it depends on the facility that you're involved with. At Misericordia, and absolutely the client should be involved in that because they need to buy into the plan. If you're coming up with all these plans and goals without them, they may or may not decide they want to, be motivated or really put their effort into it. So they should, and in some cases, they may not be able to have a deeply intellectual conversation about it, but you can usually get some information about their interests and what they're excited about and maybe certain aspects of the environment that they want to be involved in. And so that is a way that you can include. You can also get information from family members. And in some facilities like at Misericordia, there were assessments that were done. It could be a cognitive assessment, a physical assessment, so that we really understood what the baseline was for that particular person, so that we were designing goals that were relevant and also would be achievable. And we would do that as a team. That was one of the great things about Misericordia. I, as the horticultural therapist, was part of the treatment team. And so, there would be the physical therapist would know more about their physical function than I would. Their mental health specialist would know more about certain things. So we'd come together and make those decisions together. But then if it was happening in the greenhouse, I would be the one charting it and refining it and things like that.
Yeah, awesome. Thank you. And I have it's not a question that's been asked in the chat, but this is from my perception. I was a local agent in a rural area, and most of our work when we did this kind of work with senior centers or nursing homes is we would be going in for an hour or 2 hours every day as volunteers and interacting with patients or clients. And I know that some of our volunteers have the opportunity and the ability and the relationship with like actual facilities to maybe help and do some of this work. But if we're just going in for a small period of time, and for example, our unit did lots of crafts activities, some from the FAD database. How can we, in our shorter interactions, maybe less formal interactions, how can we still use these practices and be kind of moving towards that goal and help the facility if the facility isn't really at the level that you were describing?
Yeah, I think again, if you can do a little research on your group, if it's a assisted living facility or if it's a work site for people with developmental disabilities, do a little research. It's pretty easy to find, what are some of the common issues that older adults face? It could be social isolation. It could be lack of exercise. It could be loss of social roles, whatever that might be. And then think about how during that activity, whether it's a craft activity or it's a horticulture activity or it's a walking activity, how can you incorporate things that are going to help them connect socially or going to help them get a little exercise or help them feel better about themselves, increase their self-esteem. And as I mentioned with adults with developmental disabilities, a lot of times we're trying to figure out communication skills, teamwork, some things like that. So you're designing the activity with those things in mind. You can't do it all, and you can't do it all even with the ongoing program, you can't do everything in one activity. So choose something that you think the activity you're interested in doing can really help them to benefit from. Really a great example of social interaction is maybe you only have enough supplies so that people have to share them, and they're forced to interact with each other in order to do that. So that would be an example of intentionally building in social interaction. I do see a question here about mobility in the greenhouse. Both the greenhouse at Misericordia and the greenhouse that we have at Wilmot Gardens was specifically designed for accessibility. So wide aisles, we have accessible components like tables that go up and down and all that sort of thing, because we didn't want to exclude anybody based on their mobility issues.
Yeah, I'm thinking specifically of some raised beds that are put in some of our nursing home and other care facilities that are intentionally much higher. So the kind of field of play is right there. If someone is wheelchair bound, or if they just want to sit when they're doing things, which is something we found with my grandmother. It needed to be able to be done from a sitting position because kneeling in the garden beds was not something she was going to be able to do. So do you have that being in mind? Another question in the chat, like what kind of adaptive gardening tools might be best for individuals who have compromised physical ability or like situations, especially if we're not able to do an adaptive greenhouse like that. That sounds like a wonderful facility. It just may not be practical, especially if we're coming into a situation and starting to initiate something.
Yeah, and I think there are a lot of opportunities for that. I mean, these days raised beds are everywhere. So, and they can be built fairly cheaply. Obviously, if you're just going in for a one-time event, you're not going to build a raised bed. But thinking about just ways, whether it's a table that you can raise and lower, or maybe an individual tray that somebody works on, or, most of our tables are actually just like folding white tables that we can put in different ways, but we do have some adaptive ones as well. Adaptive tools, are so many out there right now to help people with arthritis or that are in a wheelchair to be able to reach into a bed. I think that if you're going to do a program somewhere that's going to be an ongoing program, the inventory is going to be really important. So you go out to the space and you see, what do we have to work with? What are some things what are the resources here that we can really take advantage of? What are some things we might need to bring in to make this more accessible to other people? So I know this is a very vague answer to the question, but I think understanding the needs of the people that you're working with and the resources that you have there at the site that you're working with them at, and then filling in those gaps can be a way to do it. I will say there's a lot of really cheap ways to make things more accessible. There's lots of expensive stuff out there as well, but I have found that master gardeners are excellent at coming up with those creative adaptations that don't have to be really expensive.
Yeah, thank you. I see a question here in the chat about, do you offer programs for children. And so we have a very robust 4-H program in Virginia, and I'm sure we do in many of our states, very robust 4-H program in Virginia. But infrequently our volunteers are engaged with youth through that. But they may also encounter youth in these situations too.
Yeah, in the current program, we don't work with children regularly. We do work with a lot of young adults, but we do have the baby gators, which is like the preschool come first field trips and that sort of thing. And that's a lot of fun, but I would like to work with more children in the future. We've just found that that's a little more challenging because of their school schedule and transportation and that sort of thing. So we don't right now work with them regularly, but I can see a lot of crossover with 4-H and some other things. Maybe that it's some kind of therapeutic horticulture thing gets tied onto that. But again, I'll also say that, remember, therapeutic horticulture is for people with a defined issue, disease, disability, circumstance. So while, what we think of as neurotypical children can certainly benefit, we know that from being outside and interacting with plants and nature, just because they're in a garden doesn't mean they're getting therapy. So I think understanding the distinction there is important. So to me, working with 4-H kids would be some kind of, whether it was education or it was understanding personal wellness and the relationship with nature and how that can help their wellness. That's not really therapeutic horticulture, but it's very important. So just kind of understanding that terminology can help a little bit. And I would love to work with kids more in the future.
Do we have time for one more question, Lee?
I do, if you guys do.
Yeah, I have, obviously we won't get to all of them, but a core of our Extension Master Gardener mission is education. And I tell all of our volunteers we're volunteer horticultural educators. And so I am wondering how you would encourage our volunteers to advocate for this kind of work and experience for those in care facilities or other clients like that. Because we may not be able to actually do that and perform all of these services on this level, but I think a really core part and sometimes where I see things fall apart is interacting with the community partners. So interacting with the medical professionals, interacting with the facilities to kind of advocate for ourselves and advocate for our programs in these spaces, because I see a ton of benefit for it, but to equip our volunteers to go out and do maybe a little bit more than they've been doing, they also need to know how to have these conversations with medical professionals. So do you have any advice in that area?
Well, there is a lot of research that's going on right now in terms of particular populations, and older adults is definitely one of them. So I think that probably the most important thing is credibility. And so you can be more credible by, having some research to kind of back up the point you're trying to make. I will say that to me, one of the silver linings of COVID was that people really started to recognize the importance of interaction with nature and plants and all that kind of stuff. And so I think that some of the path has already been paved for us in that way. I think medical professionals are much more open to be thinking about this. It's not a trendy thing anymore. People are recognizing that. But if you could go to one of these places and say, hey, there's this other program that I know about, same group that's having A, B, and C beneficial results. And there's also this research paper that talks about why. What do you think about us, trying to put together a program to address some of these issues? That might be a good way to do it. That's kind of what I do when I'm trying to get people to expand a little bit. Examples and research are always helpful.
Yeah, I agree. I think we have lots of really good questions. It might be useful for me to compile some questions that we've missed and maybe some others that are emailed to me, and then see if we can give them more comprehensive feedback. We unfortunately don't have a ton of great resources in Virginia for this, but we have a lot of enthusiasm from our volunteers. So I will compile some questions from here. Volunteers, if you want to email me at emgoffice@bt.edu with short questions, because ideally Lee will be reading them all. So brevity is always appreciated when we're compiling over 200 questions, but
You know, and if
I
can I just
really-
insert one thing real quickly, Grace? I saw a few questions about education. If
Yes,
you are
ma'am.
interested in finding out about more opportunities, the American Horticultural Therapy Association website is great. It's just ahta.org. I'm going to actually put it right in the thing right now, ahta.org. And they have a section on education. And so they'll tell you all the different, there's not that many of us, there's about 8 of us around the country, and those that are, you know, distance, those that are in person. And that's a great place to start to sort of look at what some of the different opportunities are.
Yes, yeah, I would love, I'll also be adding links and things with our recording. I always post the recording and then I add various links nearby. So stay tuned for that, guys, because I know that this is a need for some more education with us. That being said, everybody thank Lee for her wonderful presentation, very informative and great answers to all of her questions too.
Thank you. I really enjoyed it.
Thank you. Bye.
Bye.
Thank you so much.